We have both a crisis of affordability in the American healthcare system and decades of research that show that we have both, at times, too much care, times too little care, and sometimes unsafe care. We've known for a number of years now that value-based care, in other words, paying for quality and outcomes as opposed to just paying for the volume or activity of care, promotes both quality and affordability. That puts decision-making in the hands of clinicians and their patients. And I think that is the best way to do it. Clinicians don't like to be second-guessed by health plans or regulators or others. They believe they know what's in the best interest of their patients, and I agree with that. And patients themselves increasingly want more say and more involvement in medical decision-making for their own care. And so with value-based care, the incentives go right into the physician-patient relationship. Yet it hasn't grown sufficiently in the United States. So what can we do to expand value-based care? Partly we need the government payers, such as Medicare and Medicaid, to invest more deeply in this, and they've really started to do that, so that's exciting. The other thing is we need better tools to persuade physicians that this is the best way to go. One missing piece for a number of years has been having good data. Insurance companies had to take the data out of the claims that they pay their providers. But increasingly, we can actually get that data straight out of the electronic medical record, ensuring we have the latest data exactly as it's recorded in the patient's own records. And so I think as technology improves, as physicians understand that this is both a legitimate way to pay for care and actually responds to their own instincts to want to provide the best, safest, and most efficient care for their patients. We've now have more than a decade of research which actually demonstrates that, which shows that value-based care, when done appropriately, can both improve care and lower costs, which is kind of the holy grail of healthcare today.